Hello, my name is Jay Africa, and I'm the Director of Behavioral Health and Recovery Services in Marin County. May is Mental Health Awareness Month, and during this month, communities across the country organize to raise awareness about the importance of caring for our behavioral health alongside our physical health. COVID-19 has presented a situation that none of us could have imagined a few months ago. The fact that the virus is extremely contagious has resulted in school and business closures, physical distancing, and quarantine measures which have disrupted our daily lives. It is more important now than ever to pay attention to our mental health and well-being. While feelings of sadness and anxiety and fear are completely normal during times like this, imagine what it would be like if you had a pre-existing mental health or substance abuse condition. Approximately half of us will experience a mental health challenge, yet the prospect of facing stigma and discrimination prevents many people from reaching out for support. In the US, 1 of 5 adults have a mental illness, and 1 out of 25 have a severe mental illness. The lifespan of individuals with serious mental illness is likely to be 20 to 28 years shorter than the general population due to the underlying health conditions such as diabetes, cardiovascular disease, risk factors linked to negative COVID-19 outcomes. Many folks living with mental illness are socially isolated, which impacts their well-being and their ability to recover. In a time of physical distancing, it is even more important for folks who have mental health conditions to find creative ways to connect with the community. The disruption to routine, difficulty sleeping, poor access to food, and reduced access to support systems can compound these behavioral health challenges to a point where feelings of hopelessness, suspiciousness, and worry may become all-consuming. Providing extra support to individuals living with a mental health or a substance abuse disorder and their families are especially important. Practicing empathy and saying, "I'm here for you," literally can save someone's life. Here are a few things you can do to recognize Mental Health Awareness Month while maintaining physical distancing. Number 1, adopt healthy habits. Eat nutritious foods, stay hydrated, get enough sleep, practice mindfulness, and get some physical activity. Take a moment to get some sun and breathe in some fresh air. Number 2, reach out and socially connect with someone. Call someone and tell them how grateful you are to hear their voice. Share a joke or two. Laughter is a pretty good antidote to stress because it lowers cortisol. Number 3, become informed about the signs and symptoms of mental health and substance abuse conditions. Take a mental health first aid or an online psychological first aid class. Know what to look out when someone is distressed or in crisis, but more importantly, know how to provide reassurance and support. Number 4, be familiar with local support and services and resources related to mental health and substance abuse, like NAMI, the National Alliance on Mental Illness, or the Suicide Prevention Hotline at 415-499-1100. Or call us through our BHRS access line at 1-888-818-1115 for any mental health or substance abuse resources. It is likely that the experience of trauma, stress, anxiety around becoming sick, the death of loved ones, job loss, and prolonged isolation will be felt by many. With appropriate support from family, friends, community, and even behavioral health professionals, we'll be able to cope and recover. Please know that there are many of us who care deeply about you and your well-being. The staff at Behavioral Health and Recovery Services are deeply committed to support you and your families. And before I forget, to all the mothers out there, Happy Mother's Day to you. I wish you good health.